Welcome to the PTCB Prep Guide. This is where we break down everything you need to know into clear, high-yield study sessions. Today's module is all about psychiatric medications, and trust me, this is a topic that is guaranteed to show up on your exam. So let's make sure you're ready to absolutely ace this section. By the end of this, you're going to have a solid grip on the key concepts and drug names that trip up so many people. All right, let's dive right in.
So here's our game plan. We're going to start with the absolute fundamentals, the neurotransmitters that are really running the show. Then we'll get into the nitty-gritty of mood disorders, anxiety, schizophrenia, and ADHD, covering the must-know drugs for each one. And don't you worry, we're going to wrap it all up with a super fast, high-yield recap to make sure you've got this stuff down cold.
All right, first up, the basics. Understanding the why behind these medications makes remembering the what a whole lot easier. It all boils down to just a few key chemical messengers in the brain: serotonin, norepinephrine, dopamine, and GABA. Let's get to know them.
So what are we even treating here? Well, a psychiatric disorder is basically a nervous system issue that messes with how a person thinks, feels, and acts. The meds we're about to cover, which are called psychotropics, work by tweaking the levels of those brain chemicals. Think of it like this. Serotonin, that's your mood and happiness regulator. Norepinephrine is all about alertness and energy. Dopamine is the key to reward and focus. And GABA? GABA is the brain's main brake pedal. It just calms everything down.
Okay, let's move into our first major drug category, mood disorders. You could think of these conditions like a symphony, where some instruments are just way out of tune. The medications? They're like the conductor, helping bring everything back into harmony. We're going to focus on the two big ones, depression and bipolar disorder. Now, it is so important to get the difference between these two straight. With depression, we're talking about that persistent low, that feeling of sadness and hopelessness. Bipolar disorder, on the other hand, is a whole different ballgame. It's a condition of extremes, with cycles of those depressive lows and what are called manic highs. So digging a little deeper into depression, the root of the problem is often a shortage of those mood chemicals we just talked about: serotonin, norepinephrine, and dopamine. When those are low, you see symptoms like lethargy and a total lack of interest. So naturally, antidepressants work to fix that shortage. But, and this is critical, it's a serious condition, and these meds carry a boxed warning for an increased risk of suicide, especially in those first few weeks. You have to know that.
And here is the solution. These right here are the rock stars of antidepressants, the SSRIs. That stands for selective serotonin reuptake inhibitors. Basically, they stop the brain from sucking serotonin back up, leaving more of it available to boost mood. Now, for the PTCB, you have to match the generic to the brand. Let's go. Citalopram is Celexa, escitalopram is Lexapro, fluoxetine is Prozac, and sertraline is Zoloft. Drill these pairs.
Now, for bipolar disorder, we need something different. We need mood stabilizers to even out those highs and lows. Again, brand and generic recognition is everything. Lithium is the classic. The brand name is Escalith. Then you have a few others that, fun fact, are also used as anti-seizure meds. A little memory trick I like is Lava-C. Lithium, valproic acid, that's Dapakine, lamotrigine, which is Lamictal, and carbamazepine, which is Tegretol. Okay, quick check-in. Time for some active recall. The slide's asking for the brand name of lamotrigine. Go ahead and pause for a sec and see if you can pull it from memory. Got it? It's Lamictal. Awesome job if you got that. If not, no worries at all. Just take a second to review and lock it in your brain.
All right, we've got mood disorders down. Let's move on to our next group and see how it all connects. We're going to look at a cluster of related issues: anxiety, insomnia, and OCD. And the key player linking all of these is GABA. Remember GABA? That's the brain's brake pedal, the one that helps us feel calm.
So let's quickly define what we're talking about here. Anxiety is when that normal feeling of worry just gets dialed up to 11 and starts messing with your daily life. OCD is a specific kind of anxiety with obsessive thoughts that drive these compulsive, repetitive actions. And insomnia, well, that's just the frustrating struggle to fall asleep or stay asleep. For really intense, acute anxiety, the go-to class is the Benzodiazepines. These guys work by boosting the effect of that calming neurotransmitter, GABA. You absolutely 100% must know these for the exam. Let's start with two really common ones: alprazolam, which is Xanax, and clonazepam, which is Klonopin. The other two big players are diazepam, brand name Valium, and lorazepam, which is Ativan. You see that PAM and LAM ending? That's your big clue that it's a benzo.
Now, for insomnia, we often use a class of drugs that people call the Z drugs, and you'll see why in a second. They work by targeting specific receptors in the brain to help you get to sleep. The big three you need to know are zolpidem, brand name Ambien, escitalopram, which is Lunesta, and zaleplon, brand name Zanata.
Okay, another quick brain check. We know serotonin and norepinephrine play a role in anxiety, but what was that main neurotransmitter that acts like the brain's brake pedal? The one that's super important for calming things down? Yep, you got it, it's GABA.
All right, moving right along to our final category, before we do a big recap, we're going to tackle schizophrenia and ADHD. Now, what's so interesting is that both of these conditions are linked to dopamine, but in completely opposite ways. It's a fascinating contrast.
So, here's the key takeaway. It's a tale of two dopamines. Schizophrenia is often linked with too much dopamine activity, and that can lead to symptoms like hallucinations. ADHD, on the other hand, is linked to not enough dopamine and norepinephrine, which causes problems with focus and attention. See? Total opposites.
So, to treat those high dopamine levels in schizophrenia, we use antipsychotics. These are the heavy hitters, so you'll for sure want to have these down for your test. Let's run through the pairs. Haloperidol is Haldol, olanzapine is Zyprexa, quetiapine is Seroquel, risperidone is Risperidol, and aripiprazole is Abilify.
And for ADHD, we do the complete opposite, right? We need to boost dopamine and norepinephrine. We do that with CNS stimulants. The ones you have to know are the combo amphetamine/dextroamphetamine, brand name Adderall, and methylphenidate, which is Ritalin. A good tip, think A in Adderall for amphetamine. And for Ritalin, I always think M and R, methylphenidate and Ritalin.
Okay, one last recall check to really burn this in. What's the brand name for methylphenidate? Come on, it's one of the most famous ADHD meds out there. It's Ritalin. Connecting those two is a guaranteed point on your exam.
All right, let's bring it all home. We have covered a ton of information. So now let's boil it all down into a high-yield recap that's going to be your secret weapon for the exam. These are the absolute must-know connections.
Honestly, this slide right here is pure gold. Let's walk through it one last time. For depression, you think low serotonin, you treat with an SSRI like Zoloft. For bipolar, you think mania and depression, you manage with a mood stabilizer like Lithium. For anxiety, you think low GABA, you treat with a benzo like Xanax. For schizophrenia, you think high dopamine, you treat with an antipsychotic like Abilify. And finally, for ADHD, you think low dopamine, and you treat with a stimulant like Ritalin. If you can master these 5 core connections, you are in fantastic shape.
You did an incredible job focusing through all that material. Seriously, great work. Now, keep that momentum going. If you found this guide helpful, do me a favor and hit that like button, subscribe, and ring the bell. And be sure to check out our other PTCB Prep guides. We've got you covered on everything from pharmacy calcs to sterile compounding. Keep up the amazing work, and I'll see you in the next one.